Hi guys, welcome back. As usual, we're going to start with a question. So let's start. Actually, I have two questions for us today before we go to the lecture. So let's start with the first question. A 63-year-old man presents with chest pain and is diagnosed with myocardial infarction. Biopsy of the affected tissue shows preserved cells outlines and loss of nuclei and increased eosinophilia. Right? What type of necrosis is most likely present? So looking at here, we have a preserved cell architecture, right? Whereby on the inside we have a dead cell, right? No nucleus, and there's increase in acidophilic dye. So this is classic for coagulative necrosis. Next question. A 52-year-old woman presents with enlarged tender breast 3 days after a trauma. And as you know, in the breast, there's a lot of adipose, a lot of fat. So the biopsy shows chalky white deposits and a ghost-like adipocyte. So ghost-like means that those adipocytes, they have no nucleus. Which process is responsible? So this is going to be a form of non-enzymatic fat necrosis. So this is a form of soap. So it's going to be calcium deposition due to fat saponification without using enzyme. Remember, as opposed to in acute pancreatitis, whereby we're going to see enzymatic fat necrosis. So today, we're going to be talking about necrosis, which is a form of cell death. And I remember in our previous lecture, we spoke about cellular adaptation, right? Then we talk about hypoxic cellular injury. We also discuss free radical mediated cell injury. And now we're going to talk about cell death. So there are actually two major ways, right, that a cell could die. A cell could die through necrosis or through apoptosis. And apoptosis is a programmed cell death. And for the purpose of today's lecture, we're going to focus on necrosis. So what's necrosis? Necrosis is a localized area of cells or tissue death. So you just have a localized area whereby the cells or the tissues there are dead, right? And this is often followed by acute inflammation, because if you have a localized area whereby the cells there are dead, the only way you can get rid of them, you need inflammation. So neutrophil is going to move there from a normal tissue. So the normal surrounding tissue, neutrophil move there, cause inflammation. And after neutrophil causes inflammation, then macrophage is going to come and feed on those what? On those products of inflammation. And that's how we're going to get rid of those what? Dead tissue. And the one thing I must mention is necrosis is always a pathology process, never physiology. As opposed to when we get to apoptosis, apoptosis could be pathology or it could be physiology. And when we look at different type of necrosis, the way they are being named based on the gross fusion, right? So for instance, if you see coagulative necrosis, right, you're going to see cell with preserved architecture, although all the cells inside those tissue are dead, then we're going to call it coagulative necrosis. For instance, if you look at liquefactive necrosis, when you look at the tissue are all liquefied, right? Then you're going to call it liquefactive necrosis. For instance, if you see necrosis with a lot of cyst-like appearance, then we're going to call it what? Caseous necrosis. So let's start with the first type of necrosis, which is coagulative necrosis. So coagulative necrosis is a form of necrosis that is caused by ischemia or infarction. And the one thing I must mention here is every time you have infarction to any tissue, right, that usually leads to coagulative necrosis. But one of the exceptions is in the brain. In the brain, you could have liquefactive necrosis. We can have liquefactive necrosis in the brain. So when you look at coagulative necrosis, the cell architecture is usually preserved. But the protein inside those cells or inside those tissue, right, they are being denatured, including the enzyme that's supposed to break them down. So the enzyme that's supposed to break down those dead tissue, they are also denatured. So that will prevent proteolysis, which is the reason why you're going to see coagulation of dead tissue, right, or dead cell inside the tissue. And then the cell could look like a ghost outline, meaning that you have a cell, right, there's no nucleus in the cell, right, the nucleus has disappeared and it's just a dead cell. And the most common type of necrosis, so coagulative necrosis is the most common type of necrosis. And it's usually due to ischemia, right? When we use the word ischemia, is sudden loss of blood supply to the tissue, and that could lead to infarction of the tissue, which can lead to what? Necrosis of the tissue. Um, This can also be due to ingestion of heavy metal. So sometimes when people ingest heavy metal like lead poison, right, that could release free radicals, or ionizing radiation that could also release what? Free radicals. And both of them could also lead to what? Coagulative necrosis. Can somebody remind us from our previous lecture, what type of free radical is released from heavy metal or ionizing radiation? Very good. Hydroxyl free radical. And remember, I said that hydroxyl free radical is the most destructive free radical of all, right? Very good. So let's talk about the mechanism of coagulative necrosis. How does this happen, right? So like we mentioned, most of the coagulative necrosis, they do to what? They do to ischemia. So if there's ischemia, then there ought to be loss of blood supply to the tissue. And if there's loss of blood supply, there will be decreased oxygenation of the tissue. So there ought to be tissue hypoxia. And then because of the tissue hypoxia, that will lead to decrease in ATP production, because we can't go into the TCA cycle and the mitochondria will not be able to use the oxygen. And then because of decreased ATP, then the pump is going to fail. We stop working. And what type of pump are we talking about here? The sodium potassium ATPase. Ideally, that pump is supposed to take out 3 sodium out of the cell in exchange for 2 potassium. And if that cell is not working, if that pump fails to work, then guess what? You're going to have retention of sodium in the cell. And wherever sodium goes, what follows? Water follow, and that will lead to what? Cellular swelling. And if you remember from our discussion of hypoxic cellular injury, we said the earliest finding in hypoxic cellular injury is what? Cellular swelling. And it's a form, is actually reversible. So once you restore the blood supply, the oxygenation of the tissue, you can actually reverse it. So moving on. So because of this decreased oxygenation or tissue hypoxia, guess what's going to happen? Then the tissue will be stuck with anaerobic glycolysis. So they can't go into the TCA anymore. So they're going to be doing glycolysis without oxygen. And if you are doing glycolysis without oxygen, you're going to be making just only 2 net ATP at the expense of producing a lot of lactic acid. So those pyruvates that are supposed to go into the TCA cycle, right? So those pyruvates will be shunted to production of what? Lactic acid. And as you're producing lactic acid, that will lead to acidosis of those cells, and that will lead to decrease in the pH. So the intracellular pH will be decreased. And that's when you look at our dye, we use the acidophilic dye, and that makes the cell look pink or red. So this acidosis is going to denature the protein, and it's also going to denature enzyme. So as a result of that, you're going to have a tissue, right, with a lot of cells in it, and all those cells, they are all what? They are all denatured by the what? By the acid. So they are all dead what? Dead cell. And then guess what? You can't break down this dead cell, right? Because this acid also denatures the enzyme that's supposed to break down those dead cells. So that prevents autolysis. So the proteolysis is inhibited, and that prevents autolysis. So as a result of that, the architecture of that cell will be what? Will be preserved, or the tissue will be preserved. But inside this is all dead what? All dead tissue. And when you look at the gross findings, so we're going to see pale, firm, slightly swollen, right, as a result of these, right, in the early stage. And with time, it could progress to yellow, softer, and a shrunken tissue. So what are we going to see on the microscopic level? So on the microscopic level, we're going to see a preserved outline, like we mentioned, of the tissue with eosinophilic cytoplasm. Why did they call it eosinophilic? Because it appears pink when you apply acidophilic dye, right? Remember, the pH inside the cell is decreased, is acid, right? And so by the time you apply acidophilic dye, right, into the cytoplasm, so those cytoplasm, they're going to bind to those acidophilic dye, and they're going to appear pink or red, and they're going to call it what? Eosinophilic cytoplasm. And then also the nucleus with time is going to disappear. So initially, there's going to be pycnosis, right? Pycnosis is what? Nuclear condensation. And they're going to see karyoesis, which is nuclear fragmentation. And then with time, you're going to see karyolysis, which is what? Nuclear dissolution. And so what will be the outcome of this coagulative necrosis? So like we said, the enzyme that's supposed to break it down inside the tissue, right, have been what? Have been denatured. So how are we going to break it down? So the surrounding normal tissue, so around those dead cells, we still have some normal tissue. So from those surrounding normal tissue, then inflammatory cell will start to move in, right? And the first inflammatory cell there will be neutrophil. Remember, neutrophil is implicated in acute inflammation. So that neutrophil is going to come there and it's going to cause what? Inflammation. And as neutrophil is coming, is causing inflammation here, is going to be releasing is what? Hydrolytic enzyme. And that will start to digest those what? Dead tissue. And that's why coagulative necrosis could progress to what? Liquefactive necrosis. So sometimes when patients have coagulative necrosis, it can progress and become liquefactive necrosis, which we're going to talk about in a second. And also with time, macrophage is going to come there and they come and remove those what? Those debris, and they clear them out so that it can facilitate what? Tissue repair. So you can see there the inflammatory cells like neutrophil macrophages from the surrounding normal tissue infiltrated the necrotic tissue, causes inflammation, liquefactive necrosis, or phagocytosis, those dead tissue. And like I mentioned earlier, ischemia in the brain present as liquefactive necrosis. And if you look at the picture here, right, so you can see those pink area, right, and the loss of nuclei there, right, due to coagulative necrosis. And you can also see a ghost cell outline there, whereby you have a cell there, the cytoplasm appear pink, and you can see there you don't see a nucleus there. The nucleus has disappeared or is undergoing what? Undergoing karyolysis. So that's coagulative necrosis, guys. So moving on to the next type of necrosis, which is going to be liquefactive necrosis. So liquefactive necrosis is a form of necrosis that is characterized by complete enzymatic digestion. So that's why they call it liquefactive. So those enzymes, they're going to digest those dead cells. And then once they digest them, they're going to liquefy them and they become liquid, creamy, yellow, and which is what we call pus. So they're going to appear like pus. And this liquefactive necrosis in the brain, it could be due to ischemia. So if somebody have ischemia, remember I said that ischemia in every tissue, most of the tissue will lead to what? Coagulative necrosis. But in the brain, it's going to lead to what? Liquefactive necrosis. And I'm going to see the reason why in a second. Bacterial infection will also lead to liquefactive necrosis because with bacterial infection, neutrophil is involved, and the neutrophil is going to release its hydrolytic enzyme. And those hydrolytic enzymes, they're going to what? Hydrolyze the tissue. And like we mentioned earlier, if somebody has coagulative necrosis, it will also progress to liquefactive necrosis. So let's look at the mechanism of liquefactive necrosis. So softening of the tissue by lysosomal enzyme that's released by necrotic cells, or hydrolytic enzyme that is released by neutrophils in the case of bacterial infection. So we're going to look at two examples here. So one is CNS infarction. So in the brain, so whenever there is CNS infarction like ischemic stroke, there are going to be release of hydrolytic enzyme by the neuroglia cells. And those hydrolytic enzymes will start to digest those tissue, right? So which is what we call autodigestion. And that will lead to liquefaction of the infected brain tissue. And because of that, if this is the brain, right? If that's the brain, and let's say the stroke is here, so once they liquefy those area, what's going to happen now? Then the macrophage of the brain is going to move there. And who is the macrophage of the brain? The microglia cells. So those microglia cells there, they're going to move there and they're going to remove those what? Those dead tissue, those liquefied tissue. And once they remove them, that will now create a what? A space in the brain. So that will create a cystic space in the brain. And then once those cystic space is created in the brain, then the astrocytes is going to proliferate, try to fill up those cystic space. And that reaction is what we call reactive gliosis. So reactive gliosis is what? Is the proliferation of the astrocytes trying to fill up those space back, right? And then with time, they could develop what we call glia scar, right? So glia scar in the brain. And that's why if somebody keep having multiple recurrent stroke, ischemic stroke, every time they keep losing brain tissue. And that's why with time, they could be predisposed to what? Vascular dementia, right? Which is a stepwise memory loss. Moving on to the second example, guys, which is abscess. So infected tissue by bacteria. So when bacteria infect a tissue, right, then guess who is going to come in? Neutrophil, because neutrophil is involved in bacteria killing, right? It gets rid of bacteria, and it's an acute inflammatory cells in the presence of bacteria. So that neutrophil now is going to infiltrate those tissue and it's going to release what? Hydrolytic enzyme. And then from the word hydrolytic enzyme is going to hydrolyze those tissue. So that will liquefy the infected or dead tissue, producing also is going to produce a what? A cavity filled with purulent spot material. No wonder if somebody have pulmonary infection, so if they have pulmonary infection and it leads to pulmonary abscess, so when you look on that imaging, either your CT scan or your X-ray, what you're going to see, right? So you're going to see the fluid right, which is the liquefactive tissue, and then you're going to see, right, you're going to see air on top, and we call this what? We call it air fluid, right, level with cavitation, right, with cavity. So whenever you see these together, right, always in the lung, always think of what? Pulmonary abscess, right? And then what are we going to see on gross? So on gross, we're going to see soft tissue with liquefied center containing necrotic debris. And in microscopy, you can see cystic space with necrotic cells, debris with neutrophil, or macrophages depending on the stage of necrosis. So what's going to be the outcome of this liquefactive necrosis? So in the case of brain infarction, like we mentioned earlier, the cystic space is filled by reactive gliosis, right, which is proliferation of the astrocytes. And in the case of abscess, the proliferating fibroblasts. And then once the abscess is drained, then that will allow what? That will allow tissue repair. So we can repair the tissue back to normal. And of course, if the abscess is not drained, then you can start having proliferating what? Fibroblasts in that area. Trying to, because remember, abscess is a wall of infection. The image here just showing somebody who have ischemic stroke, and with evidence of what? Gross evidence of liquefactive necrosis. So not to prolong this lecture, we're actually going to split the necrosis into 2 or 3 part lecture. So this is going to be the first part of the lecture, and in the next video, I'm going to talk about the remaining types of necrosis. Don't forget, guys, to subscribe for more videos, and I will see you guys in the next video. Thank you.